So we'll quickly get to look at when patients are too ill or injured, so to say. So when patients are too ill or injured patients, how can the radiographer, what are the various tips, okay, to the radiographer handling, this set of people? Okay, so too ill or injured patients. So handling ill or injured patients in radiography, of course, you have to be careful. So your clinical skill is needed. You have to also put yourself in their shoe. So your empathy is needed. Then you're also ensuring the safety of the patient. You don't want to complicate their issues. So this has to do with the radiographer is trying to adapt their techniques to the patient's condition. So clear communication is needed, and you reassuring the patient is also very good. Where you are speaking calmly and clearly, you are explaining everything that will be done to the patient to, them, because this will help you to now reassure the patient and also build trust. Make it that the patient is not discovering new things by themselves, but you have already explained it. So patient assessment, you have to now evaluate how the patient is positioning. You want to actually ensure that they are very stable for the imaging, there's no pain, and they are conscious. So you have to now make a review of their medical history and physical examination that probably was done before you go in for the imaging. Then safe positioning, you have to adapt the best positioning method that will fit the condition of the patient, so that you get a very good picture once and for all. Okay, to avoid repetitive exposures. So you can use all those immobilization aids, like all those sponges, the straps, the sandbags. Okay, the radiation safety, this is where you now apply the Alara principle to limit exposure. You use shield for sensitive areas. That's why you now talk about all those gonadal shielding and the rest of it. Okay, but there are different shields in the body though, just to make sure that for the parts that are not being imaged directly, they are reducing the amount of exposures to them. Okay, so teamwork, you have to be in good communication with other staffs, the porters and other radiographers. The compassion and professionalism is you have to show empathy and patience. You have to put yourself in the shoes of that patient, and you don't just act as if you are probably a small god that won't get sick someday. So that's what we have for the various steps if you want to actually take care of a very ill patient or an injured patient in a radiology lab. Okay, this is some of the things that you should actually follow for this.